Okay, good morning, everyone, and thank you for joining us today. We're going to go ahead and get started with the Arizona State Loan Repayment Program orientation webinar. Just a few house items that we need to discuss is we are recording this webinar, so if you could please mute your line so that we can have a clear recording. We will be sending the recording as well as the PowerPoint once it's posted on our website. We will be sending that out to everyone so that you have access to it as well as where you will find it on our website. Again, I want to reiterate that this is the last orientation meeting, and it is very imperative that you guys listen to know the ins and outs of the program. Also, one last thing, if you could email me, this is Ashley Ness, if you could email me that you attended today's conference. We are marking off to see who has and has not participated, and then those who have not will reach out to you directly. Again, please make sure you mute your line, and we will go ahead and get started. We'll first go around, introduce ourselves to you in the room. My name is Ashley Ness. I'm the Workforce Health Planning Consultant.
Good morning, everyone. My name is Anna Rossetti, and I'm the Section Manager for Workforce for the Arizona Department of Health Services, Bureau of Women's and Children's Health. I will be covering the State Loan Repayment Program orientation webinar today. I want to welcome you all to today's webinar. I know that you all are busy, and I want to thank you all for taking time out of your busy schedules to attend this webinar. So briefly, I'd like to provide you a brief overview of the Arizona Department of Health Services. Some of you may be familiar with our department, but this chart shows you the different departments within ADHS. We have the state hospital here at ADHS, also the Division of Policy and Operations responsible for all of our fiscal and grant management efforts. And then in the middle of your screen is a Division of Public Health Services. That is a division that is responsible for administering all of the programs and services here in our department. We have over 300 programs and services. The workforce program, specifically the State Loan Repayment Program, is housed under the Division of Public Health Prevention on the left-hand side of your screen under the Bureau of Women's and Children's Health. The Women's and Children's Health is the administrator of the Arizona Primary Care Office, which is the federally designated office for the state that is responsible for ensuring improved access to care to the residents of our state, and that is through a cooperative agreement with the U.S. Department of Health and Human Services, Health Resources and Services Administration. The Arizona Primary Care Office's core functions, there's a number of them. We try to develop and implement strategies to strengthen healthcare systems, and that includes primary care, medical, dental, and behavioral health. We also administer programs that aim to increase the number of healthcare professionals working in underserved communities. We also help in identifying areas that need improved healthcare through the federal and state shortage designations. And then, of course, we work with our statewide partners, providing technical assistance wherever we can for those communities that may need improved access to care, maybe setting up new access points for care, community health centers, or for those employers who are looking to improve the recruitment retention efforts or expand services to their constituency. So those are the items or functions that we have here in the Arizona Primary Care Office, which is again housed within the Bureau of Women's and Children's Health. So I want to welcome you all to the State Loan Repayment Program. As State Loan Repayment Program participants, we are really excited that you all joined the program. Of course, you have committed to serve in an underserved area for an obligation of 2 years, and hopefully that you all have received your contract. So I want to make sure that you all know that we are committed to support you throughout your service obligation, and that we want to ensure that you have a positive experience as program participants. And as SLRP obligated providers, it is, I think, important for us to work together to make sure that that we, the program staff and ADHS as a whole, are trying our best to meet your needs and expectations. And in exchange, I also want to make sure that we understand those concerns that you have in terms of your obligation and any questions that you may have about the program. So as SLRP participants also, you need to understand, of course, what are the requirements for you and also things that you need to do to comply with program requirements and expectations. Also, make sure to understand that you have options, that you're not stuck necessarily. If things are not working out with you and with your current employer, and say you are looking to move somewhere else, you have an option. It is ultimately up to you and your intent to fulfill the terms of your contract as long as you understand what your contract means. And truly, it is service to the underserved, in that signing your contract obligates you to a full 2 years of service with the program. It is important for you and I to communicate, you and the program, including Ashley here. You will be hearing a lot from her throughout the 2 years of your service obligation, but communication is really key to a successful partnership. So just know that we are always within reach by phone or email. If you have any questions, concerns, anything that we can help you with, we are here to help you address those concerns. So the SLRP contract, like I said, most all of you, I believe, have already received your executed contract. Some of you may have a delayed start date, and so if you haven't received your contract, watch for it. Someone from the procurement office will be sending the contract to you. But for most of you in the call today, I believe that you already have a contract. Please make sure to read your contract thoroughly. That is essentially your reference for anything and everything that you have questions on regarding, you know, your service requirements, your reporting requirements and deliverables, etc. You have to ask questions if you're unclear of certain provisions. So in your contract, there are 5 different sections. One of them is the uniform terms and conditions, and then the special terms and conditions, the scope of work, the price sheet, and then there's an appropriate attachment. Now, uniform terms and conditions, or UTC, have been developed by the State Procurement Office, and they're included essentially as part of every solicitation and contract which is developed by the state of Arizona. The provisions in the UTC apply to all state vendors, and in this case, you all, as participants of the State Loan Repayment Program, are state vendors. We are procuring your primary care services or your dental services or behavioral health services in exchange for receiving funding for loan repayment. So in this case, you are considered state vendors, and the provisions in the UTC apply to all of you, and it's based on the state procurement code. Language in the UTC may not be revised. Examples of content are, which you may have already come across these content or sections, requirements for contract changes, there's risk and liabilities provisions, remedies for contractual noncompliance, termination and suspension. Special terms and conditions are conditions and terms specific to the actual program contract requirement. And in this case, the FTC section of your contract has specific conditions related to the State Loan Repayment Program. The FTC may expand upon or supplement the terms and conditions contained in the UTC. So examples of the content that you may have already come across with are vendor payment, your contract terms. So contract term for different programs may mean differently. So in the State Loan Repayment Program, our contract term, our initial contract term is 2 years, and then renewable year to year. The contract type is a fixed price, which means that you are allocated a finite amount of money, an X amount of money, which you were all notified when you were approved for the program, as well as through your contract's price sheet. There's also provisions related to suspensions, defaults, your service requirements, provider eligibility, et cetera. So if you have not read your special terms and conditions section of the contract, please do so. Again, it's very informative and lots of information there. And if you don't or have any, sections that you're not so sure about or unclear, please reach out and we will respond to those questions. Scope of work describes the scope of your obligation as program participants, including your service requirements. Some of you were approved for a full-time status, and that is you indicated that you're working or want to participate as a full-time provider, and therefore the service requirements for a full-time participant apply to you, and that is 40 hours per week for a minimum of 45 weeks per year. And then some of you were approved for a half-time status, which means that you are required to serve at least 20 hours per week for a minimum of 45 weeks per year. The scope of work also includes the services or the service site where the services will be provided. So anytime there is a change in service site, which oftentimes when a provider is employed by an entity with many satellite clinics, this happens where the provider is assigned to originally from one site to a number of sites. Whenever there's a change in service site, that needs to be reported to ADHS prior to transferring to the new site or prior to working at the additional site so that we can execute an amendment to capture the change in where the services are provided. Requirements also include non-discriminatory provision of health services, and this is something that you certify you will comply by, as well as your service site. So you are required, because the intent of the program is to serve the underserved and the uninsured. You have to serve everyone, regardless of their ability to pay or source of payment. And that includes those that not only have private insurance, but also those that are insurance, such as Access or the state Medicaid program, those on Medicare, those on SCHIP, or you probably are familiar with Kids Care program, and of course implement a sliding fee scale for those who are not eligible for any of the government insurance programs. The sliding fee scale will be a mechanism for you to charge for the services at a discounted fee scale. Some of the deliverables are also mentioned in the scope of work, including service reporting and in what time period you're going to report for services. For the purpose of the state program, we track your services for the duration of your 2-year contract. So it's a quarterly service reporting, and we follow a regular calendar quarter, which is January to March, April to June, July to September, and October to December. So when you're reporting your services in coordination with your site administrator, you are going to be reflecting those specific quarters in your reporting, and that is it. After every 90 days of service, you are required to report. And then the form to submit, it is entirely electronic. And so before the end of each 90 days of service, you will get a courtesy email from our portal. It's an auto-generated email letting you know that there's a report that is due. That email can be sent to your site administrator, and your site administrator will see those reports in their system. So it is important that as participants of the program, you are familiar with the reporting requirements and that you're working with your site administrator to make sure that you're responding to those requirements in a timely manner. And then also the scope of work includes the contact information. That includes your address, your phone number, your email address, where we're going to either notify you or call you when we need to talk to you, or have questions about your service or whatever it is that is needed for us to communicate to you. So every time there is a change in your home address, you need to communicate it to us. And every time there is a change in the home address, you need to not only file a request in the portal but also submit a new substitute W-9 form. It is the same form that you submitted when you applied to the program, but the substitute W-9 form is used for tax purposes. The funding that you get from the state program or your lender will receive as a result of serving is tax exempt. And so the substitute W-9 form is something that we are required to collect from all of our participants. And every time, again, there's a change in the home address, we need to gather a new substitute form, W-9 form. And then, of course, the APP, which is the Arizona Procurement Portal. I know some of you think that this is not a very user-friendly interface, but APP is something that you have to keep your updated profile, and that includes reflecting the new address. Because our procurement department actually use the information on the APP to either set up a contract or amend your contract. So anytime there's a discrepancy, that will show in their end. So on their end. So please make sure that you know, whenever there's a change, to update your APP information. Price sheet specifies the quarterly rate that you will be or your lender will be disbursed after each 90 days of service, and this is contingent upon verified service. What I mean by that is after you submit the service verification electronically through your site administrator's portal, after we verified that the submission is acceptable, and then once we received the information and we verify the information, we then forward it to the finance department so that they can process the check for your lender. Now, there are some of you whose qualifying loans were below, or I'm sorry, some of you were awarded up to your total loan indebtedness. So let's say you applied for the state loan repayment program and you only had $40,000 of student loan debt, and you received that amount because that is the total qualifying loans that you reported. And so because the state program disburse the funds quarterly, you may be making additional payments every month, which means that you will be paying your loans sooner. If at any point during your 2-year contract, let's say you've already been in the program for a year and a half, and let's say you only have 2 more quarters left, and you were projecting that the quarterly balances on your account will be less than the scheduled payments that we will be dispersing your lender, you need to notify us so that we can make the adjustments in your contract. By policy, we cannot issue a payment that is over and beyond what you owe. So unless you notify us that that is the case, we will not know otherwise. And what happens is, if we issue a payment to your lender that is over the amount that you owe, your lender will not cash the check. It will be returned. It will be returned as an overpayment to either, and they send it to either the provider or to the program. And this really creates a lot of unnecessary work for the program, for our finance team, and for our procurement. So make sure that you are, you know, looking and checking your balances frequently if you're one of those providers who were awarded only up to your total loan indebtedness, to make sure that you are on top of your balances, and that if it happens that your quarterly rate or payment will be more than what you owe, let us know so we can do an amendment. Any return check, so let's just say in an event that we did issue an overpayment and that the payment was returned to the provider, all the return checks must be mailed to that address that you see on the screen. It's the Attention Accounting Department, and the address that's listed on there. So the price sheet also indicates the lender to be paid. So if you're with Great Lakes or with Nelnet or with Firstmark or with Fed Loan Servicing, it reflects the lender's information on the contract. Anytime there is a change in the lender information, be it the lender payment address, maybe you consolidated your loans and now you move from Fed loan servicing to maybe you consolidated with a private company, Wells Fargo or FirstMark. You need to let us know because you need to file a request for change in the portal for any time there is a change to your lender information. So when you're consolidating your loans, it is important to note two things. One is the consolidation has to only include loans that were initially approved for state loan repayment program. If you were approved for $200,000, those same loans can only be included in consolidation. You cannot add any other loans to the consolidated loans. Otherwise, that will render all of the consolidated loans ineligible. Okay. So one of the things that we will check is when you consolidated your loans, we will ask for an itemized breakdown of the loans that you consolidated, and we have to make sure to identify that those are the exact same loans that were reported at the initial application and were approved for the SLRP program. So every time there's a lender change, lender address change, loan account information change, all of those will require an amendment, and all of those will have to, we will ask the provider to file a request for change in the portal, or the provider themselves can do it on their own. Every time there's a change request in the portal, we get notified on our end, and we will know obviously who files it and what type of change is being requested. So make sure that you're, proactive about these things. That way we can prevent any issues with, lender checks being lost in the mail or just sitting somewhere, or return checks and things of that nature. Attachment A is an example of the service verification and encounter report form. This is just the form that's available in the portal for download. It's just, the sample form is not meant for you to submit a paper form. It's just providing an example of what it looks like. But mainly the service reporting is done by your site administrator. So work with your site administrator to complete the online form. The completed form, similar to the sample form that's on your contract, must be downloaded for printing, then signed and notarized. So that's when you come in as provider, is that it is, the form requires your signature, because you're basically certifying that you were in fact working during the period that you're reporting, and that's a full quarter or it could be a partial quarter. But you're also certifying that you did provide the services that's listed on the form. So it will include the total number of encounters that you provided during the quarter, and of the total number of encounters, the number of sliding fee scale encounters. It will also include, if you're a telemedicine provider, the services provided via telemedicine, and where the site or the other site where telemedicine, where the originating site where the provider actually served in a telemedicine capacity. And then the submission of the form, and again, this is electronic, will trigger processing of loan repayment checks. And what I mean by that is we get notified whenever the form is submitted, and that's when we retrieve the information for processing and forwarding to accounting. Reminder emails are again generated to inform the providers that these reports are due. So watch out for those emails. Check your spam folder regularly, because sometimes we've gotten reports that's going to the spam folder. So please make sure that your spam folders are being looked at on a regular basis, so you're not missing these due reports. We will not accept mailed in service and encounter report forms. Certainly some of our providers were not following the online reporting format. Make sure that you're not having your site administrator printing the document and mailing it in. We're not going to accept any mailed in forms. And it is the responsibility of the SLRP participant to ensure that all deliverables for the quarter are met, okay? Contract amendments are required in a number of situations. One of them I mentioned is whenever you're changing a service site or employer. So you decided if things are not working out with your employer, now you're moving to a different employer. A change in employer or service site will require an amendment to your contract. So make sure if you're contemplating on changing employment, let us know in advance. We can, of course, provide technical assistance in terms of whether your new prospective employment meets the requirement of the state loan repayment program, because sometimes providers assume that where they're transferring is an entity that would be eligible, but there are times where we then realize that the new site or employer is not an eligible site. So before you sign your contract with a new employer, make sure that the new entity is eligible for the program. When you're adding a service site to an existing approved site or site, so you were assigned initially for to work at one site, and now they're adding 2 more sites, that will require an amendment. When you're changing your service hours from full-time to half-time, you were approved for full-time status for the state loan repayment program, and now you're converting to half-time because maybe you just had a baby and now you can't fulfill the full-time hours. That can be done through a contract amendment. Please note, though, that if you're converting from full-time to half-time, your contract amount will be adjusted accordingly to half the total amount of your full-time contract. So if you were awarded $50,000, when you work half-time, you will then be reduced to half of the $50,000, which is $25,000. Change in your loan or lender information, which I covered extensively earlier. Whenever the balance that's due in your account is less than the scheduled payment, that will require an amendment. Whenever there's a payment address change, and when there's a lender change that's either through a consolidation or your loan was sold to another servicer, those will require a lender, a contract amendment. A contract amendment. And then home address changes, again, this will require a substitute W-9 form and updating the APP system. And every time there's a gap in service, and this is mainly when, say, you're anticipating a prolonged absence from work because of a medical condition, for example, or you're taking FMLA for 12 weeks because of maternity, or for any other reason where you anticipate a prolonged gap in service, then your contract may be extended depending on the length of time that you will be gone from work. So in your contract, you might have seen something in the special terms and conditions related to the 35 days or work days per year that you are allowed to be off work. And that applies to this situation where you're taking, say, FMLA for 12 weeks, but you were only allowed 7 weeks. In this case, you will then, your contract will then be extended by 5 weeks, okay? So we will take, it is kind of a case-by-case scenario in terms of when we would extend the contract, but the 2 important things that are important for us to know is when you are going to start when the day off is going to start. So let's say if you're FMLA and you know that you're going to be out starting November 1, we need to know that so that when we do the amendment, we know exactly the last day of your service at the site, and then also we want to know when you're going to return back to work in a full-time capacity. So one of the things I may or Ashley may be asking you, if you were one of these providers asking for to be out of work, is when is your start date of leave, and then when are you going to return back to full-time status? So if, for example, you were approved for a full-time status and then you're returning back to work after a prolonged gap in service as a half-time provider, then we need to know that as well. So whenever there are situations like this, is anticipated, one of the things that we will ask is for the provider to request for a contract suspension, because essentially the suspension will suspend or freeze your contract so that you're not going to be out of compliance with the service requirements for the state loan repayment program, right? So when you suspend your contract, it will allow you to suspend for a period of time, and during that time frame, there will be no service requirements that you have to do, obviously, because you're out of work. But at the same time, there's not going to be loan repayments that will be disbursed to your lender. Changing employer or service site, let us know if you have a desire to change employer or service site to make sure that the new employer or service site is eligible for the state loan repayment program. So some of the providers, we've come across transfers where the provider mentioned something like, well, my site is an NHSC site or the National Health Service Corps site. I hope you are familiar with the federal program, which is NHSC. Well, they must be eligible. So one thing to remember is not all NHSC sites are eligible for the state loan repayment program. Okay, and then the second thing is if you're transferring to an employer, it has to be either a public or private nonprofit entity or a rural private practice site. So if you're moving, from one eligible site to a site in, say, an urban area, say in Maricopa County, which is an urban county, but you're moving to a private practice, that private practice is not going to be eligible for the program. So be careful before you sign your contract with a new employer. Make sure that they are eligible for the program. Again, filing a request in the portal in order for us to be notified of the change, and then also execute an amendment to your contract. And then every time there is a change in employer or service site, there is the employment verification process that needs to happen. It's the same process that your site administrators had to do when you applied for the program. Is when you elected your site, an email is automatically generated to the site administrator, who will then be responsible for verifying employment at that facility. So same exact process when you're changing changing employer or service site. Now, the required documentation when you're changing an employer or service site is we will require a copy of the new employment contract or an employment letter certifying your hours. Again, if you're moving, we expect that you're continuing to be a full-time provider if you were approved as a full-time participant. And therefore, we will ask that the new employer certifies your service hours, which is full-time, 40 hours per week, if you were approved for full-time, or half-time if you're working half-time at the new or with a new employer. And then the employer letter or a contract must also indicate the service site name and address and the your start date of service at that particular site. Now, if you're changing employer and you're filing a request in the portal and you can't see the employer name in a drop-down menu, it is likely that that employer has not been a participant of the program. So you let us know if this ever happens where, you can't find the employer in a drop-down menu, and what we will do is we will add the employer's name in our portal so that you can then proceed with your request. Now, if you're transferring, say, you were approved for $65,000 as a physician or a dentist because your HPSA score, you're working in a HPSA score of 18 to 26. Okay, so by statute or by policy, we have specific authorized amounts depending on your HPSA score. So a HPSA score of 18 to 26 for physicians and dentists, they're eligible for $65,000. Now, things didn't work out, you're moving to a new employer, and the new employer's HPSA score is now a 14. So you're going from an 18, let's say, to a 14. Well, your contract, has a $65,000 allocation. Now it will go down to whatever is the appropriate amount for that HPSA score, which I'm going to show you later. So make sure that you're aware that every time you're moving from one higher HPSA score area to another, the contract amount may change. Not always, but it may change depending on the score of the new facility. So this is the authorized award amounts that we have to go by. So in my example, if you're in your first 2 years of service and you're in a physician or dentist in a HPSA score 18 to 26, you were awarded $65,000 and now you are moving to a HPSA 14, then your new contract will then have an amount of $58,500, okay? So it is important to be aware of these nuances in the requirements because these are things that we have to comply by when we're amending the contract or reviewing the request for a change in employer or service site. We are bound to these requirements, and so I hope that you don't expect to keep your contract amount the same if you're moving from one high HPSA to another. When you're changing service hours from full-time to half-time, again, you're going to request a change in the portal and upload the required documentation. And again, in this particular instance, an employment letter is needed to certify the revised service hours that you're going to provide at least 20 hours per week. So in the state loan repayment program, when we say half-time, we really mean 20 hours per week. Some of our half-time practitioners may be working 16 hours per week. Those are not going to qualify as a half-time practitioner. So half-time practitioner for the purpose of the state loan repayment program is 20 hours per week or more, but less than 40 hours per week. So you can be working at 32 hours and be considered half-time. But for full-time practitioner, the requirement is 40 hours per week. You can work more than 40 hours, but not less. So, the employer letter also has to include a site name and address and the effective date of the change of the conversion from full-time to half-time. Okay, so again, when you're changing from full-time status where you were awarded a full amount to half-time, your contract award amount will be reduced to half. When you're changing service hours from half-time to full-time, this is only granted at contract renewal. So you're not precluded from converting from half-time to full-time with your employment with a specific employer or facility. However, for the purpose of the loan repayment program, we will not, even though let's say you're awarded as a half-time practitioner and then you began working as a full-time practitioner at Community Health Center A, you can do that, except you're not going to get an increase in your award amount because you're working full-time. The only time that we will consider a request in the change in service hours from half-time to full-time is when you're renewing your contract for year 3. And the reason really because normally when we make the award during the June allocation cycle, we exhaust all of our funds. So we may not have available funds for providers who are converting from half-time to full-time. And that's the reason why we are not able to accommodate any conversion from half-time to full-time, much as we can accommodate full-time to half-time status. If a provider needs to temporarily reduce hours to accommodate a life event, again, it could be a maternity leave, it could be a prolonged absence due to a medical condition, where the provider will be temporarily unable to fulfill the terms of the contract, then a contract suspension is needed. You may contact us and we can guide you on how you can submit a contract suspension. It's essentially a form that you'll need to fill out. This is the only functionality that we're not able to still do in our portal. So it is, once you tell us that you're interested in suspending your contract, what you'll need to do is just communicate it to us by email, and then we can send you the form to submit along with other paperwork that we will be asking from you. And then once that's done, we basically amend your contract and and include in your contract the contract suspension period and then a change in your price sheet. So anytime there's a suspension of the contract, the period of suspension will not be eligible for any loan repayment disbursement. So if you're asking for a 6-month suspension, for example, those full 6 months we will not have any disbursements to your lender. It essentially freezes your contract. Now, upon contract renewal filing for a year 3 continuation, like I mentioned, you may apply as a half-time, you can apply actually that's incorrect. I think that meant you may apply as a full-time provider, and once you were approved, you may convert then from half-time from your initial 2-year contract to a full-time at year 3. Now you're changing loan or lender information. I've talked about this, but I'll briefly go over this. File a request in the portal, and as soon as the lender notifies you that the provider notifies you that the payment address of your lender has changed. This actually happened recently with Fed Loan Servicing, and what we ended up doing is reaching out to many of you once we were made aware that the lender payment address has changed. Then we had to include that in the original contract request that we have had to do with procurement. Now, once you were notified by your lender that the payment address has changed, make sure that you notify the program or file a request in the portal. So if you don't do this, and let's just say you submit your service forms and we process your forms and we forward it to accounting, whatever lender is reflected on your contract, that will be the lender or the lender payment address where we will issue the check to. So it really creates a problem if we don't execute an amendment in a timely manner when a change occurs, So one of the things that may happen is, the check gets to the lender, to the address that's on the contract, but it may still be in the same building, or it may still be in the same location with different PO box number, but it just sits somewhere and nobody knows where it is, and provider calls the 800 number of their lender, and nobody knows whether it's been paid or whatever it is. So what happens is when you call us and say, hey, I don't think you issued my loan repayment, we will provide you the warrant or the check number and the date that we issue the check, so that when you follow up with your lender again, you can provide them with that information, and they can locate the payment. That's likely just sitting around somewhere in their office, which happens a lot, actually. So update the qualifying loan section to the appropriate change that's needed in the portal, and then you have to upload the required documentation. So if you're filing a request for lender payment address, then a copy of the lender documentation bearing the new payment address, and then the billing statement with the loan account number is also acceptable. If there's a lender change due to a consolidation, then you have to submit a copy of the consolidation document that includes the itemized loans that were consolidated. Again, we need to check that the original approved loans were the same loans that were consolidated later. So if you're looking to consolidate your loans, you have to show proof, again, of the itemized consolidation. A copy of the billing statement from the new lender or the new consolidated loans, including the account number. Sometimes the account number stays the same, and sometimes it changes. So make sure to include that when you're filing a request for change under the qualifying loan section, to update all the relevant information related to the change. So be it the account number, payment address, and the lender name change. And then, of course, your balances. When you consolidate your loans, your balances obviously change. So in the qualifying loan section, you need to reflect accordingly what the current balances is on those loans after the consolidation has been finalized. Gaps in service, anticipated prolonged gaps in services must be communicated to us. Again, send an email to the department and then include the start date of leave and anticipated return date to full-time or half-time service. Depending on the period of time of the leave of absence, you may be advised to request a contract suspension, or you may file a contract suspension using the form that we can send you. Allowable gap, as per my, you know, as I discussed earlier, is 35 work days per year or 7 weeks. Contract extension is required for any gaps beyond 35 days. So in my example, if you're taking an FMLA for 12 weeks, which is also found on the bottom of your screen, is that if you're taking an FMLA for a full 12 weeks, ADHS will extend the contract for 5 weeks, and then the quarterly rate for the period where a full quarter of service will not be provided is prorated accordingly. So we use a formula and in order to prorate the quarters that you're not fulfilling a full quarter of service. Okay. Ashley will then, right now, do a demo of how you're going to file a request for change. And then also the service reporting requirements.
Okay, bear with me. I'm going to share my screen so you guys can all see it. Okay, so like Anna has mentioned previously, when you're filing a request for change, it's going to be in the exact same portal that you initially used for your initial application for the state loan repayment program. So it's the same website. It's also going to be the same email and password that you signed up with. So I have a dummy account for this demonstration. So we'll go ahead and log in. Just to let you know, there is the forgot password if you need assistance with that, or if for some reason the website's not working, please let us know. So we'll go ahead and log in. It'll take a hot minute, but like Anna said, the change application is going to be used for changing in lender, changing in personal information, a change in loan account information, or a change in employer or service site. So let's see if it'll let us log in really quick. We'll try it again. There we go. So this is going to be what your portal now looks like. This is the home page. You've already submitted your application. You can see down here that, you know, this is a dummy account, but you can, you can see here that you filed one. It was approved. Anytime you file a change, it'll appear down here as well. So you can see that this provider has already filed a change application previously in the year 2019. So the button you're going to look for, say, you know, you forgot to add something or you need to file another change over the course of the 2 years, you'll hit this button right here, which is called Request for Change. So we'll go ahead and click on Request for Change, and it'll ask you, are you sure you want to file a request for change? You will hit Continue. And then it will take you to your pre-filled and a much simplified version of your initial application. So you can see up above, there's only 5 sections instead of the numerous sections that were initially on your application when you first started. So anything can be changed. We have a tool available to us to see what you changed. You can change your address. You can change, if you get married, you can change your name. You can change your phone number or the email address that you want us to have on file. Just make sure that this is always up to date. And once you've finished with your personal information or discipline, you can just go to the bottom and hit Save and Continue. Now, I do want to preface all, let's select the gender really quick. I do want to preface all of this information that you only have to make changes to the sections that you need to make changes to. There will be pop-ups that will appear, like right now where it says Request for Change. Are you requesting a change to your loan or lender information? And it gives you the option to say yes or no. This allows you to, if there's nothing going on with your loans, you can click no and it'll take you to the next step. If, for the purposes of this demonstration, though, we're going to click yes, just so you guys can see what the information looks like. For the loan information, that second pop-out box will occur, and it'll ask you to provide what Anna has already stated. It will ask you you need to input the updated loan information. You need to make sure that you upload a recent billing statement, and that will be done in the supporting documents section. So it's exactly mirrors what you initially did on your initial application. So we'll click OK, and you can see here that all of our loan information has been pre-filled. You can type in a different payment address if you'd like. To reflect, we do double check to make sure what you've provided and what's on the billing statement is correct. If the account number, say you've consolidated your loans and it's a completely new servicer, you can go through and completely redo this. Again, there's still the instructions. If you now have more than one loan servicer, you can add that. So we will just hit save and continue for the purposes of this. Now it's going to go on to the next step. It's going to ask you if you have a change to your employer or service site. Again, there's a yes or no option. Please do not feel that you have to address every single section. You don't have to address every single section. So we're going to click yes, and it's going to ask you, are you changing your service hours at any of the approved sites listed below? Again, you can hit yes or no. For the purposes of this, I want to hit yes so you guys can see what it'll look like. And it also says, please ensure that you verify your service hours for all approved sites. So what you can do, it's the same format. We can see that for this provider, they've already have an accepted and completed site for ADHS, and their employer is AZDHS. So let's say that you need to add an additional site, that your employer has decided and you've agreed that you need to split your time between two clinics. So you'll click right here and make sure you choose your employer. You will then choose your site admin, and then all the sites that are related to that site admin of Ashley Smith will appear. So we can see there's only 2 sites associated with her. We already have the ADHS one added, so we're going to add the test site. And then you have to hit the add site button. So now it's been added. Now it's pending and incomplete, whereas below it's accepted and complete. So your service site admin will just get an email stating that they need to address your employment verification and validate your employment. Once that is done and it's been changed to accepted and completed, that is when you will be able to submit your change application. Now, let's say that you do have 2 sites, they've already been accepted and completed when you initially filed, but you have to verify your service hours. What you can do is you can click verify service hours, and then is there a change in your service hours from full-time to half-time or vice versa to this site? If there is, you'll click yes, and it goes, defaults back to, it'll default back to this, meaning that your site admin gets an additional email that they need to revise your hours for that site. Again, since they're both in this pending and incomplete state, we cannot, you will not be able to successfully submit the change application until your site admin has addressed these 2 sites. You can also delete sites. If you're no longer working for a specific employer or at that specific site, you can always delete or remove sites. So we will go back and add just one, and then we'll hit continue. It'll let you know, as I mentioned earlier, that you can't proceed until your site admin has done their verification process. So that pop-up just lets you know. And then this is where you will come in and you will initial next to each item. This is basically giving us permission to look at your loan information and to obtain supplemental information if needed for the purposes of the application. So you will hit save and continue. And this is the supporting document section. You can see that it's broken up into 4 separate categories or issues that could arise. For example, change of address, change of loan or lender information, employer or service site information, and change of service hours. And then under each of those bullet points, so if you have a change of address, it clearly states exactly what you need to upload. You need to upload the W-9, and we can provide that to you. And you need to update your address in procurement, in the Arizona procurement portal, which you can click here and it'll take you to the website. So it gives you exactly what you need to provide to us. You'll click view document, and you can either drag and drop or you can click to upload. So we'll just click to upload, and we will upload a document really quick for the purposes of this demo. And then make sure that you hit save. Once you hit save, it'll tell you that the file has been uploaded successfully. We've had people in the past doing this and they forget to hit save, and then they send the entire change application to us, and then there's no supporting documents. So just make sure you hit that save button. Now, once you are fully done, you'll hit submit application. And it tells me I cannot proceed past this point until after the site admin completes the application verification process. And you will receive a notification that it's been completed. So what the website is referring to is that this is still pending and it's still incomplete, and so your server site admin has not done their piece of it. So you would have to get in touch with them. Once that's completed and all of that's good to go, you can go back to the supporting document section and hit submit application. So that's the process of a change application. That is, you need to file, please make sure when you file a change application that you don't file separate ones every week or something like that, or every day. Make sure that you're only having to do one change application. We understand that maybe 2 months from now, all of a sudden your loan information changes. Please feel free to do a change application, but this system allows you to do multiple changes for each of the tabs. So I'm going to log out really quick, and then I want to show you guys what the service verification and encounter report form looks like, the process for that. I just want to let you guys know that this portal is for the service site administrators. This is what they see. You will not see this. The only part that you'll have to do for the encounters is to sign. So like I mentioned, this is what the portal looks like for your service site admin. So the tab that they will be using is step 6, the encounter information. Your service site admin will click step 6, and then this is where they will be taken. They can choose year, they can choose the quarters, they can choose the status, meaning pending means that they have to complete them. Completed means that these are the ones that they've already successfully sent to us at ADHS. So we will go ahead and look at 2019, quarter 3, and pending, and we'll hit search. And these are all of the service verification encounter forms that need to be submitted to us at ADHS. So what your provider does, what your service site admin does is click on edit, and then the provider name pops up, which would be your name, the year, as well as the quarter. Your service site admin can make any notes here if they would like, and we can see it on the back end. You can see here that no sites are added. So what your service site admin would do is click add site encounters. And then this is where your sites will appear. Please note that only the sites that you have been successfully registered for on your initial application or your change application or on your contract will appear here. If the site is not listed here, it means it has not been approved by us here at ADHS, and a request for change needs to be filed to either add or change your service site. So this will not be able to be submitted until you've done your piece of doing the change application. So you can see here for Ashley Joe, the only site that she's registered for is ADHS. So we'll click ADHS. Your service site admin will click if you're full-time or part-time. We'll click full-time, and then they need to enter the total encounters. So let's say she did 1,500 encounters during that quarter, and that 35 of those encounters were done using a sliding fee scale. So your service site admin will need to get in contact with your billing department to address these questions. Now, if you provide telemedicine services, there's a yes or no option. No, if you don't, then everything is, these two options are grayed out, and your service site admin does not need to fill it out. If your service site admin clicks yes, then they need to enter the number of hours per week or hours during that quarter that you worked. Telemedicine services, which is 35. Now the telemedicine originating site, again, any sites that you are working at or providing telemedicine services have to be approved. They have to be in the system, and for the purposes of this, you can see that there's only one site. So if you see if your service site admin does not see a site listed, that means that you have not filed a change, a request for change, and that needs to be done prior to that. So for the purposes of this, we'll click no. And then critical hospital services, if you're working at a critical hospital, you'll click yes, and then your service site admin will list the number of service hours. If no, they don't have to fill that out. Again, like I mentioned, if you have multiple sites you're working at, your service site admin will click add site encounters. Now, for the purposes of this demonstration, provider Ashley Joe only has one service site associated with her account. So this warning message is letting us know that all the encounters for all the sites belonging to this provider have been added successfully. So once your service site admin has entered all of your sites, they will hit save. It's letting them know that they have successfully saved and that they need to download the form. It'll be a pre-filled form, and that they have to sign and get it notarized. So I'm going to show you what that looks like. So they will download the encounter. And as I mentioned, it will be pre-filled with the information that your service site admin has inputted earlier. So it'll pop up here in a hot second. Maybe. There it goes. So you can see here that there are 2 pages associated with this service verification encounter form. Everything has been pre-filled according to what your service site admin has inputted. This section right here, it says to be completed by SLRP participant. That is you. You have to sign and date and then get your signature notarized in this middle piece. You then hand it back to your service site admin, and their signature of the service executive director or administrator or authorized signatory needs 2 signs right here at the bottom. They also need to date their signature, and their signature also has to be notarized. This second page, you do not need to worry about. That is for our use. But once this is all signed, everything is notarized and good to go, your service site admin will then upload it back into the portal. Once they have uploaded it back into the portal, they can see the name of it. Sorry. Whoops. My apologies. They can upload something. They'll see the name of the document they've uploaded, and they will hit save. It'll ask them if they're sure and that they need to make sure that the form is signed and notarized, and they will click OK. Then it's been successfully submitted. They can't make any changes to that. So when I get the email stating that it's been successfully submitted, if there are any issues, I will reach out directly to the service site admin and to the provider themselves to let them know that maybe a notary stamp is missing or a signature is missing. So just to show you, we can see here that you can go to, the service site admin can go to completed, and we can see here that it was for Q3 for 2019, it was successfully submitted. So that is how a service site admin does your service verifications. Again, this is done quarterly. So I will log out really quick, and that was my demonstration. We'll go back to the presentation for Anna really quick. There we go.
Okay, so Ashley covered this piece, but again, service reporting is done by the site administrator through the portal accounts, and while data reporting is done electronically, the signatures, you as a provider and the employer's authorized representative will have to sign. The forms have to be notarized and uploaded back in the system. The site administrator has to make sure that there are 2-page forms that are being uploaded back in the system. Sometimes they only see the signature page, and we will ask for the second page if that's the case. So make sure it's a 2-page document that they're uploading back in the system. And Ashley already covered the service reporting. We will now go to payments. Evan is not here today to cover this, so I'm covering on his behalf. Now, once ADHS verifies the service has been reported through the portal, the form is then forwarded to finance for payment. The payments processing will take approximately 3 to 5 business days. Normally, it doesn't sit in our queue. Once we get the notification, those are pretty immediate. We process them right away, forward them to accounting if there were no issues. And then accounting takes about 3 to 5 business days. Lender's check, once available, is mailed to the lender. Unfortunately, we're still snail mailing these payments. we will use the address that's entered in the system based on what's on your contract. So again, your contract's very important, and what's reflected in the contract is very important because that's what we use to update our information, the information in our system. And so make sure that you are proactive about any changes to your lender payment address, lender information, loan account information, et cetera, that could impact the timeliness of payments to the lender. And now finance notifies program staff that check was mailed, and then program staff, you will be notified once the payment has been issued. It's basically in the portal we have a button that we select, and it generates an auto notification to the provider letting them know that the payment has been made. Now, if you believe that your loan repayment has not been received by your lender after you check online, a lot of you I know are checking your online account and you think that it's not been posted, please notify us. We will provide you the check warrant number and the mail date for your lender's reference. So normally what you're gonna do, sometimes the lender, once they receive the check, it may be sitting in their queue for a little bit before they post the payment. So if you call us, we will provide you the warrant number and the mail date for your lender's reference, and that way they can see if it's sitting somewhere there or maybe it's in the queue for processing. You know, there may be a delay in the lender posting the payment in the system, and that could be the reason why you're not seeing them electronically posted on your account. Many of you have multiple lenders, so we allow up to 3 lender payments. And normally, when you apply for the program and you have, say, 2 or 3 lenders, you let us know for your quarterly payment how you want us to split the payment towards those lenders. So if it's 3 lenders, you may have elected 50%, 25%, 25%, or if you have 2 lenders, you may have elected 50-50. Now, this form that you see here is a form that you're not going to be able to access electronically online, but we can send it to you. So anytime you decide that you want to change your election, we will ask you to fill out this form. So let's say, you know, you have 3 lenders and you've elected 50, 25, 25. And then now you want to change the election to 25% to lender 1, and then 50 to lender 2, and 25 for our 25 to lender 1, 50 lender 2, and 25 lender 3. We can do that if you submit this prioritization form to us. And normally what we do is we forward this to finance. We keep a copy and we forward it to finance so they can update your records. Suspension, I'm going to cover this really briefly. And again, the conditions that warrant suspension is when you're transferring to a new site or changing employer where there's a significant gap in service, is anticipated when there's prolonged absences due to a medical condition, or maybe you have a family member who has a medical condition where you will have to provide care for them. In other life events that will make you unable to fulfill the service obligation temporarily, you will have to request for a contract suspension. You have to file this request via email using an ADHS PDF form that we will send to you via email. We review the suspension request and we notify you if it's been approved. And then the allowable suspension period, as I mentioned, is 6 months, even though, say you submitted a request for a 6-month suspension, but then things happen where you are now able to return back to service prior to the 6-month period. Let's say you only really needed 3 months. We can always reinstate your contract sooner. Just let us know. You know, a big thing here is communication. Communicate every time there's a change in your status. Communicate if you're in suspension period and you're not going to use all of the 6-month period of suspension, let us know and we can always reinstate the contract. If for any reason before the 6-month period you realize that you still cannot go back to service, and you needed more time, you can request for another 6-month suspension. So you can be granted a total maximum suspension period of 1 year. During the suspension period, we will follow up with you about your status in terms of transferring to a new site or returning to employment from a medical leave or prolonged absence. So I included here the Arizona Administrative Code R9-15212, which states that if a provider does not obtain employment at another service site by the end of the suspension period, resulting in the provider's failure to complete the terms of the contract, the provider is in default and is required to pay the liquidated damages. Okay. That is also included in your contract. So if you haven't found that provision, go back and look. It should be there. Defaults, providers are in default if he or she fails to complete the terms of the contract. Again, you know, I've been in this program for a long, long time. It's very rare that I see default. So as long as you communicate and, you know, you allow us to help you find or, you know, successfully complete your service either through a transfer or a suspension, we can avoid default. But if you knowingly chose a site that's not going to be eligible for the program, you are intentionally breaching your contract. So you have an option, but just knowing what your obligations are with the state loan repayment program contract will help you avoid default. Penalties apply for breach of contract, which is in Section 19 of the Special Terms and Conditions, recoupment of payments, default provisions. If you haven't come across that or have not reviewed that, it's actually there in your contract. The default penalties are consistent with penalties imposed by the National Health Service Corps. We are partially funded by the feds, and we follow the same default penalties as them. The formula, again, this is in your contract, but I want to just emphasize that there is a formula for calculating the penalty for default. So even though you're allocated a certain amount of money, if you breach your contract and you fail to complete the service commitment, you will be found in default. And the formula that we will use to calculate the penalty is this one. The amount paid to the or allocated to the participant for any period not served, B, the number of months not served multiplied by 7,500, and then the interest. So in the example below, you see that Dr. Jones had a 2-year service obligation and he received 65 grand of SLRP award, but he defaulted on July 1 of 2014 after serving 6 months. So the amounts allocated or paid for months not served is 6 months, I'm sorry, 18 months. So 18 divided by 24 is 0.75 months, which is 65 times 0.75 is 48,750. And then months not served is the 18 months times 7,500, which is 135,000. And then the interest when you add A and B. So you can see that it's pretty steep, our penalty for default. Again, this is following the federal guidelines. You know, again, it's very rare that we see people default on their obligation, and you know, you can avoid breaching your contract if you understand the requirements of the program. Communication is key. Again, we need to know immediately, you know, if a provider is not able to complete the terms of the contract at their current site, we need to know, because for us that is a possible default, and we will try to help you find a you know, an employment prospect for you to transfer to. We will recommend a contract suspension. Let's just say you were fired from your job and now you're not working. You need to let us know so that we can suspend your contract right away, and that will prevent you from being non-compliant with the service requirements, because essentially you're not providing services when you're, you know, let go of your position, right? So let us know right away. We will provide technical assistance to assist our providers in successfully transferring to a new site. We will look to see if there's open positions we can refer you to, but on your own, you can also look through traditional ways of finding employment, as long as you know where to transfer to is eligible for the program. You have a choice to complete the terms of the contract, as I mentioned previously, but if you knowingly decided to not fulfill the terms of the contract by choosing a site that's not eligible, then you are not going to be compliant, essentially in breach of the contract. So please avoid defaulting on your contract, and before you sign with a new employer, make sure that they are eligible for our program. And finally, year 3 renewals, who is eligible? So many of you will still have qualifying loans before the end of your 2-year contract. And so you will be eligible for a year 3 renewal if you still have outstanding loans to be paid and you're in a HPSA score of 14 and above. You must submit an online application during the open cycle, which usually runs between March 1 and April 1 of each year. You have those providers with HPSA scores below 14 can also apply for renewal, but you have a different cycle, which is in October of each year. And this is just how our policy is written. By statute, we need to give priority consideration to those that are in high HPSA scores, and we consider high as it's consistent with the feds, which is a HPSA score of 14 and above. Now, courtesy emails will be sent to providers who are eligible to renew in April or in October if funds are available. So for those of you, many of you, actually all of you, will have a start date of October 1, 2019 and later, and we'll have an end date of prior to March 31, 2022. So you can apply for year 3 renewal between March 1 and April 1 of 2021 during an open cycle. This will be posted on our website, and the link to the portal will also be posted on our website. The notification of awards will occur sometime in July of 2021, and you're not obligated for year 3 until you sign your renewed contract. So because we're notifying you in advance, even before your initial contract is done, usually you're not obligated until you actually sign the year 3 contract renewal. Okay, so even though we will ask you to temporarily accept the offer for year 3 renewal, unless you sign the contract is when you are actually officially obligated. All future renewals beyond year 3 is competitive, and this usually occurs during an October application cycle. So make sure you plan ahead. Our program has, we're not as big as the federal program, so obviously our funding is also limited. So if after year 3, and we know that we're not going to have an October cycle within which you will renew for year 4, plan ahead. You can plan to apply for the National Health Service score at that time, or if we're fortunate to have more funds to open an October cycle, then obviously you can submit a year 4 renewal through the state loan repayment program. And that is all the information that we have for the state loan repayment program. I know it's 1:10. We will address all of the questions right now, and then we will finish the presentation. This is just the contact information that you see on the screen, my contact information, and Ashley's, as well as our director for the Arizona Primary Care Office is Patricia Tarango. Any questions related to HPSA designation and score, say things are not working out again with your employer, you're transferring to a site, but the site happens to not have a HPSA, maybe it has no HPSA or it has a very low HPSA, you can feel free to email Tracy or myself. I can facilitate that question for you, and whether or not the site can be designated as a HPSA or can have a high score. But that's not something that's immediately done. It's not a quick process, but we can certainly help you with facilitating those questions. Evan Marsh is our financial analyst, and he is the point of contact for any payment-related question. And Arizona Procurement Portal, this is something that is separate from the program, but all state vendors are required to have a profile in APP. Make sure that you update your profile whenever you have a change, and call the help desk if needed.
So we finished with the presentation, and I just sent everyone, you can ask questions in the chat pod. So if you have any questions, please start typing them in the chat pod, and we can start addressing them. Again, we want to reiterate that this is the last orientation. We have been recording it. We will be sending out a follow-up email once it's been posted to our website, so you guys have access to both the PowerPoint as well as the recording, so you can refer back to it over the course of the next couple years with your obligation. So it doesn't look like I have any questions in the chat pod so far. I do also want to remind you guys, please send me, Ashley Neves, let me go back to my information. Please send me an email that you were on the conference or the webinar today so that we can go ahead and mark you off. My email is right there, and you can feel free to email me today so that I can get you checked off. We want to let you guys get back to work. We don't have any questions in the chat pod. Are there any questions that we can answer? If you don't feel comfortable asking the question, Anna and myself are available via phone or email, and you can directly email us. Okay, how has the site admins been educated on this as well? What piece are you referring to? If you're referring to the changes in, if you're referring to like adding additional sites or changing employers, they have been educated on their process of employment verification and things of that nature, and they have also been educated on how to submit a service verification and counter note form on behalf of the providers. So if there's something specific that you were wondering about, if they've been educated, please let us know and we can.
And you can connect your site admin to us as well, just to make sure.
So if you don't know who your site admin is, you can reach out to us and we can let you know. Are there any additional questions? How are the funds dispersed with multiple loans?
So if you have multiple loans, say you reported 3 loans, and that should be reflected in the contract, and you assign, when you fill out the qualifying loan section, there is a section there in terms of what percentage of the quarterly disbursement will go to the lender, and you assign, say, 25%. That's what we're going to follow. We will follow those elections that you made for those loans. And then, is that the question?
So, and we can also check to see what it currently is at. I can send you a screenshot of your initial application to show you what you initially inputted, and then we can go from there. If you'd like to change your elections, I can then send you the form. So to the person who asked that question, I will send you a follow-up email after this call.
Mm-hmm. Nancy will follow up with you on that. If you didn't see that question, then it may be that you didn't do any election, but we will follow up.
So the next question is, the pharmacy I'm currently working at will be starting telepharmacy services next month for a different site. I will be named as the pharmacist in charge of the site. Is this something that needs to be added to my profile? Yes, you have to, any sites that you're working at, and it's part of your 40 hours per week or 20 hours per week for the program, have to be inputted and have to be accounted for.
But so in terms of telemedicine services, just a point of clarification in that telemedicine services have to be provided at a site that is also in a HIPSA. So the originating site where the provider is and the distant site where the services are going to be received have to be both in a HIPSA. And they have to be, yes, they have to be in a HIPSA.
Also, too, the site that you're working at, they need to register that new site in our portal. Otherwise,
if it's not registered.
Yeah, if it's not registered, then you will not be able to file a change application. As I showed earlier, you won't be able to choose the site from the list because it hasn't been registered. So you have to work with your site admin. We can be a third party in helping to get those items, those services added and resolved. But yes, it has to be an eligible site and it has to be associated with your change application because then an amendment will change. Do we have to claim this money on our taxes as income at the end of each year, or is it tax-free?
It is tax exempt. So because you don't necessarily receive these funds, your lender does. So it is tax exempt. So the substitute W-9 form that you submitted as part of your application is actually for our reporting purposes because the SLRP funds are tax exempt, and so we use that form to report on those funds.
That's why it's important that you keep that form up to date because, as Anna had mentioned earlier in her presentation, the address and the information we have on that W-9 is exactly where those tax forms are going to go to. So if you do not have an up-to-date address, you will not receive the tax form. Okay, are there any additional questions at this time? If so, you can enter them into the chat pod at this time.
Oh, so I'll be going to maternity leave in March. We have a site closer to the hospital that I would like to work at the month leading up to my leave. Do I need to request a change? So is the hospital affiliated with your current employer? Is it a totally different employer?
So, Sarah, is the hospital associated with your employer or no? Is it a completely new employer?
Okay, so if it's a different employer, we can chat because we need to make sure that the new employer is eligible for the state loan repayment program. Of course, you can transfer if it's an eligible site, but we first need to check and make sure of that.
Prior to you starting there. Okay, are there any additional questions? Sarah will reach out to you directly in regards to your specific question and situation. Okay, it doesn't look like we have any more questions. Again, we want to thank you for taking time out of your busy day to attend this orientation with us. Again, please make sure that you have open communication with us, and please email me to let me know that you were on today's meeting. Thank you so much for your time, and we hope you have a good day and a good rest of your week.